Welcome back. Tonight, we explore 30 of the most disturbing human experiments ever conducted, real cases that shaped modern medical ethics forever. From secret government mind control programs to researchers who treated people as disposable test subjects, these documented experiments crossed every moral boundary. Each story represents a dark lesson that ultimately led to the human rights protections we have today. So settle in, dim the lights, and prepare to discover 30 chapters of scientific misconduct that changed the world. Whether you are here to learn or drift off to sleep, these historical cases will show you how far humanity has come. Let us begin with our first experiment that shocked the world. 1. The Stanford Prison Experiment, 1971. In the summer of 1971, psychologist Philip Zimbardo transformed the basement of Stanford University into a mock prison for what would become one of psychology's most controversial studies. 24 college students were randomly assigned roles as either prisoners or guards in an experiment designed to last 2 weeks. Within just 6 days, the situation had spiraled so far out of control that Zimbardo was forced to terminate the study early. The student guards had become increasingly sadistic and authoritarian, while the prisoners showed signs of severe psychological distress, depression, and learned helplessness. Guards stripped prisoners naked, forced them to perform humiliating acts, and denied them basic necessities like food and sleep. Some prisoners experienced complete psychological breakdowns, crying uncontrollably and begging to be released. The experiment revealed how quickly ordinary people could adopt abusive behaviors when placed in positions of power over others. Zimbardo himself became so immersed in his role as superintendent that he lost sight of his responsibility to protect the participants from harm. The study violated numerous ethical principles, including informed consent and the right to withdraw without penalty. Participants were not adequately informed about what they might experience, and when some tried to leave, they were initially discouraged from doing so. This experiment fundamentally changed how psychological research is conducted, leading to stricter ethical guidelines and institutional review boards that must approve all human subject research. 2. The Milgram Obedience Studies, 1961. Stanley Milgram conducted his famous obedience experiments at Yale University in 1961, seeking to understand how ordinary people could be compelled to commit acts of cruelty under authority pressure. Participants believed they were taking part in a learning study, but the real purpose was to test their willingness to administer what they thought were painful electric shocks to another person. The setup involved 3 people: the participant as the teacher, an actor playing the learner, and the experimenter in a lab coat who gave instructions. When the learner gave wrong answers, the teacher was instructed to deliver increasingly powerful electric shocks ranging from 15 volts labeled as slight shock to 450 volts marked as danger severe shock. The learner was actually an actor who received no real shocks but responded with increasingly desperate pleas, screams of pain, demands to be released, and eventually fell silent as if unconscious or dead. Despite these disturbing responses, 65% of participants continued to the maximum voltage when prompted by the experimenter with phrases like, "The experiment requires that you continue." Many participants showed extreme signs of stress, including sweating, trembling, nervous laughter, and pleading with the experimenter to stop. However, when the authority figure insisted they must continue, most complied. The study revealed the frightening extent to which people will obey authority figures, even when doing so conflicts with their personal moral beliefs. Participants were not informed that the shocks were fake, causing many to believe they had seriously harmed or killed another person. This deception caused lasting psychological trauma for some participants who struggled with guilt and self-doubt long after learning the truth. 3. The Tuskegee Syphilis Study, 1932-1972. For 40 years, the United States Public Health Service conducted one of the most unethical medical studies in American history, using poor African American men in rural Alabama as unwitting test subjects. The study, officially called the Tuskegee Study of Untreated Syphilis in the Negro Male, began in 1932 with 399 men who had syphilis and 201 men without the disease as a control group. The participants were never told they had syphilis, instead being informed they were receiving free treatment for bad blood, a local term that described various ailments. The men were provided with free meals, medical examinations, and burial insurance as incentives to participate, but they never received proper treatment for their condition. Even when penicillin was discovered as an effective cure for syphilis in the 1940s, researchers deliberately withheld this life-saving treatment to observe the natural progression of the disease. The study continued for decades, causing unnecessary suffering, disability, and death among the participants. Many men died from syphilis-related complications, while others passed the disease to their wives and children. The research was conducted without informed consent, and participants were actively prevented from seeking treatment elsewhere. When they tried to enlist in the military during World War II, researchers intervened to ensure they would be excluded from the armed forces, which would have provided them with syphilis treatment. The study only ended in 1972 when a whistleblower leaked information to the press, causing a public outcry. This scandal led to major reforms in medical research ethics, including the requirement for informed consent and the establishment of institutional review boards to oversee human subject research. 4. Hypothermia. Experiments at Dachau. Between 1942 and 1943, Nazi doctors conducted brutal hypothermia experiments on prisoners at Dachau concentration camp under the direction of Dr. Zygmunt Rascher and Dr. Ernst Holzlöhner. The stated purpose was to help German pilots who had been shot down over the North Sea by determining how long they could survive in freezing water and testing methods for rewarming hypothermic patients. Approximately 300 prisoners were subjected to these torturous experiments, with about 80 to 90 dying as a direct result. Victims were forced to endure freezing temperatures in various ways. Some were submerged naked in tanks of ice water for up to 5 hours. Others were strapped to stretchers and left outside naked in sub-freezing temperatures, and some were placed in chambers where the temperature was gradually lowered to simulate high-altitude conditions. The experiments were designed to push the human body to its absolute limits, with researchers carefully documenting the stages of hypothermia, including loss of consciousness, cardiac irregularities, and eventual death. Those who survived the initial freezing were then subjected to various rewarming experiments, including being placed in hot baths, having hot water poured over them, or being forced into sexual contact with female prisoners as a supposed warming method. The data collected from these experiments was considered so valuable that it was initially used by Allied forces after the war, though this practice was later discontinued due to ethical concerns. The experiments violated every principle of medical ethics, using human beings as expendable research subjects without consent. The victims were chosen because they were considered racially inferior by Nazi ideology, highlighting how scientific research can be corrupted by prejudice and hatred. These experiments became central evidence in the Nuremberg trials, leading to the development of the Nuremberg Code, which established fundamental principles for ethical human experimentation. 5. High-altitude experiments. Nazi physicians conducted deadly high-altitude experiments on prisoners at Dachau concentration camp between 1942 and 1943, attempting to solve problems faced by German Air Force pilots flying at extreme altitudes. Dr. Zygmunt Rascher led these experiments with the backing of Heinrich Himmler and the German Air Force, using a low-pressure chamber to simulate altitudes up to 68,000 feet. Approximately 200 prisoners were subjected to these experiments, with around 80 dying during the procedures. The victims were placed in airtight chambers where air pressure was rapidly reduced to simulate the conditions pilots might experience if their aircraft lost cabin pressure at high altitudes. Researchers meticulously documented what happened to the human body under these extreme conditions, recording symptoms like convulsions, unconsciousness, temporary paralysis, and eventual death from oxygen deprivation. Some subjects were kept conscious during the experiments to provide verbal descriptions of their sensations as they slowly suffocated. The experiments typically lasted between 15 minutes to half an hour, during which victims experienced excruciating pain as their lungs expanded and blood vessels burst from the pressure changes. Those who survived the initial decompression often suffered permanent brain damage, blindness, or paralysis. The research was conducted entirely without consent, using prisoners who were selected based on their supposed racial inferiority according to Nazi ideology. The data collected was intended to help German pilots survive emergency situations, but the methods used were so barbaric that they constituted murder disguised as science. After the war, this research became crucial evidence in the Nuremberg war crimes trials, demonstrating how medical professionals could abandon all ethical principles in service of a murderous regime. The legacy of these experiments contributed to the development of international laws governing human experimentation and medical ethics. 6. Twin Studies by Joseph Mengele. Dr. Joseph Mengele, known as the Angel of Death, conducted horrific medical experiments on twins at Auschwitz-Birkenau concentration camp between 1943 and 1944. Mengele was obsessed with genetics and racial purity, believing that studying twins could unlock secrets about heredity that would support Nazi theories of racial superiority. When trains arrived at Auschwitz, Mengele personally selected twins for his experiments, separating them from their families and housing them in special barracks. He collected approximately 3,000 twins during his time at Auschwitz, though fewer than 200 survived the war. The experiments ranged from seemingly benign measurements and blood tests to invasive surgeries performed without anesthesia. Mengele injected chemicals directly into twins' eyes, attempting to change their color, performed unnecessary amputations to study healing processes, and infected one twin with diseases to observe how it affected their sibling. Some twins were sewn together in attempts to create conjoined twins, resulting in infection and agonizing deaths. Children were subjected to spinal taps, organ removal, and sexual sterilization procedures. Mengele maintained detailed records and photographs of his subjects, treating them as laboratory specimens rather than human beings. He showed particular interest in twins with different colored eyes or unusual physical characteristics, collecting these features for his genetic research. Many experiments involved killing one twin to perform comparative autopsies on both siblings. The doctor often gave candy and small gifts to children before subjecting them to painful procedures, creating a disturbing psychological manipulation that confused his young victims. Survivors reported that Mengele seemed genuinely interested in the twins as individuals, learning their names and backgrounds, which made his cruelty even more psychologically devastating. These experiments had no legitimate scientific value and were conducted purely to support Nazi racial ideology through pseudo-scientific research that treated human lives as completely expendable. 7. Sterilization experiments. Nazi doctors conducted extensive sterilization experiments on prisoners in concentration camps as part of their broader eugenics program aimed at preventing supposedly inferior people from reproducing. These experiments were carried out primarily at Auschwitz, Ravensbrück, and other camps between 1941 and 1945, targeting Jewish women, Romani people, and others deemed undesirable by Nazi racial ideology. Dr. Karl Klauberg and Dr. Horst Schumann led most of these procedures, experimenting with various methods of mass sterilization that could be implemented quickly and cheaply. Thousands of women were subjected to injections of caustic substances directly into their reproductive organs, causing excruciating pain, severe infections, and often death. Klauberg developed a method involving injecting formaldehyde, silver nitrate, or other chemicals into the uterus and fallopian tubes, believing this would block them permanently. Schumann used high-dose X-ray radiation focused on reproductive organs, exposing victims to dangerous levels that caused severe burns, internal bleeding, and cancer. Men were also targeted, with researchers using X-rays to destroy testicular tissue or performing surgical castrations without proper medical care. Many victims developed severe complications including sepsis, peritonitis, and internal hemorrhaging that led to slow, agonizing deaths. The experiments were conducted without any form of consent or anesthesia, with victims often restrained while procedures were performed. Beyond the immediate physical trauma, these experiments caused lasting psychological damage as victims realized their ability to have children had been deliberately destroyed. The research had no legitimate medical purpose, serving only the Nazi goal of preventing targeted populations from reproducing. The pain and suffering inflicted was considered acceptable by the perpetrators because they viewed their victims as subhuman. After the war, very few of the doctors involved faced adequate punishment for their crimes, with some continuing their medical careers in other countries. These experiments represent one of the most systematic violations of reproductive rights in human history, demonstrating how medical science can be corrupted to serve genocidal purposes. 8. Seawater drinking tests. At Dachau concentration camp in 1944, Nazi doctors conducted brutal experiments forcing prisoners to drink seawater to test human survival limits without fresh water. The German Air Force and Navy requested this research to help pilots and sailors who might be stranded at sea, but the methods used were unconscionably cruel and violated all medical ethics. Approximately 90 Romani prisoners were selected for these experiments, which lasted between 6 to 12 days under the supervision of Dr. Hans Eppinger and Dr. Wilhelm Beigelberg. The victims were divided into different groups. Some received no water at all, others were given only seawater, and a control group received seawater that had been processed to remove some salt. All subjects were denied food to accelerate the effects of dehydration and salt poisoning. Many became delirious, screaming for water while their bodies shut down from salt poisoning and dehydration. The researchers carefully documented each stage of suffering, noting how long it took for various organ systems to fail. Some prisoners became so desperate that they tried to drink their own urine or lick freshly mopped floors to obtain any moisture. Others attempted to drink water from cleaning buckets, leading researchers to place guards to prevent access to any unauthorized fluids. The experiments were designed to determine how long humans could survive drinking seawater and whether processing methods could make it safer for emergency consumption. However, the research methods were scientifically flawed because the extreme conditions of imprisonment, malnutrition, and psychological stress made it impossible to gather reliable data about normal human physiological responses. Several prisoners died during the experiments, while survivors suffered lasting kidney damage, neurological problems, and psychological trauma. Like other Nazi medical experiments, this research treated human beings as disposable test subjects whose suffering was irrelevant to the supposed scientific goals. 9. MKUltra Mind Control Program. From 1953 to 1973, the Central Intelligence Agency conducted MKUltra, a covert program designed to develop techniques for mind control and interrogation through psychological manipulation and chemical substances. The program was led by Dr. Sidney Gottlieb and involved experiments at universities, hospitals, and psychiatric institutions across the United States and Canada. Thousands of unwitting subjects were exposed to LSD, sensory deprivation, electroshock therapy, and various forms of psychological torture in attempts to break down their personalities and rebuild them according to CIA specifications. The program grew out of fears that Soviet and Chinese intelligence agencies had developed superior brainwashing techniques, leading American officials to believe they needed to catch up in this area of psychological warfare. Researchers targeted vulnerable populations, including mental patients, prisoners, drug addicts, and sex workers who were unlikely to report abuse or be believed if they did. Many experiments took place in psychiatric hospitals, where patients seeking treatment for depression or anxiety were subjected to intensive brainwashing attempts without their knowledge or consent. Dr. Ewan Cameron at Allen Memorial Institute in Montreal developed particularly brutal techniques including sensory deprivation lasting for weeks, massive doses of electroshock therapy, and drug-induced comas lasting for months. Subjects were played recorded messages repeatedly while unconscious, attempting to erase their existing memories and implant new thoughts and behaviors. The program also involved dosing unsuspecting individuals with LSD in various settings, including restaurants, bars, and brothels, to observe their reactions. Some subjects experienced permanent psychological damage, including memory loss, personality changes, and chronic mental illness. Several people died as a result of MK-Ultra experiments, including CIA researcher Frank Olson, who was given LSD without his knowledge and later fell from a hotel window under suspicious circumstances. The program violated numerous laws and constitutional rights, conducting medical experiments on American citizens without consent, while destroying most records when it ended to cover up the crimes committed. 10 LSD experiments on unwitting subjects. As part of the broader MK-Ultra program, the CIA conducted extensive experiments involving the administration of LSD to unwitting subjects between 1953 and 1973. These experiments were designed to test whether the drug could be used as a truth serum, a method of mind control, or a weapon to incapacitate enemies. Dr. Sidney Gottlieb oversaw much of this research, which took place in various settings including psychiatric hospitals, universities, and even ordinary social situations like restaurants and bars. Researchers dosed subjects without their knowledge, then observed and documented their psychological reactions, often intervening to maximize confusion and distress. Many experiments targeted vulnerable populations who were unlikely to report abuse or be taken seriously if they did. Mental patients were given massive doses of LSD combined with other experimental treatments like electroshock therapy and sensory deprivation. In some cases, patients were kept in drug-induced states for weeks or months, while researchers attempted to erase their memories and rebuild their personalities. The CIA also operated safe houses where prostitutes were paid to slip LSD into clients' drinks, allowing agents to observe the effects through one-way mirrors. These setups were used to test whether the drug could make subjects reveal secrets during interrogation or sexual encounters. University students and hospital patients were also targeted, with researchers often lying about the nature of the substances they were receiving. Some subjects experienced severe psychological breaks, permanent personality changes, and lasting mental illness as a result of these experiments. The doses administered were often far higher than what would be considered safe for therapeutic or research purposes, with some subjects receiving amounts that could have been fatal. Many people had no idea they had been drugged until years later when congressional investigations revealed the extent of the program. The experiments violated informed consent principles, medical ethics, and basic human rights, treating American citizens as expendable test subjects in pursuit of intelligence advantages over foreign adversaries. 11 sensory deprivation studies. Throughout the 1950s and 1960s, researchers in the United States and Canada conducted extensive experiments on sensory deprivation as part of efforts to understand and develop techniques for psychological manipulation and interrogation. These studies, many funded by the CIA through MK-Ultra and related programs, subjected volunteers and unwitting patients to prolonged isolation from sensory input to observe the psychological effects. Dr. Donald Hebb at Mengele University pioneered much of this research, paying college students to lie in small chambers wearing goggles, gloves, and ear coverings that blocked most sensory information. Initially, the experiment seemed harmless, but researchers quickly discovered that even brief periods of sensory deprivation could cause severe psychological disturbances, including hallucinations, paranoia, and cognitive impairment. As the research progressed, experiments became more extreme and unethical. At Allen Memorial Institute in Montreal, Dr. Ewan Cameron combined sensory deprivation with massive doses of LSD, electroshock therapy, and recorded messages played repeatedly to subjects in drug-induced comas. Patients seeking treatment for depression or anxiety were subjected to weeks of sensory isolation without their informed consent, often emerging with severe memory loss and personality changes. The deprivation chambers were designed to eliminate as much sensory input as possible, keeping subjects in darkness and silence while floating in temperature-controlled water or lying on soft surfaces that provided minimal tactile feedback. Within hours, most subjects began experiencing disorientation, anxiety, and difficulty concentrating. After several days, many developed vivid hallucinations, became unable to distinguish between dreams and reality, and showed signs of severe psychological distress. Some subjects emerged from extended deprivation with lasting mental health problems, including chronic anxiety, depression, and difficulty forming memories. The research was conducted under the guise of studying human consciousness and developing treatments for mental illness, but the true purpose was developing interrogation techniques that could break down a person's psychological defenses. These experiments violated medical ethics by causing deliberate harm to subjects, many of whom were vulnerable psychiatric patients seeking help for their conditions. 12. Project Artichoke. Project Artichoke was a CIA program that operated from 1951 to 1953, focusing on developing interrogation techniques and methods for memory manipulation through a combination of drugs, hypnosis, and psychological pressure. This program proceeded and eventually merged into the larger MKUltra project, sharing many of the same unethical research goals and methods. The program was designed to determine whether subjects could be forced to reveal information against their will, have their memories erased, or be programmed to perform actions without conscious awareness. Artichoke researchers used a variety of techniques including LSD, sodium pentothal, hypnosis, electroshock therapy, and various forms of psychological torture. The program targeted prisoners, mental patients, and other vulnerable individuals who were unlikely to report abuse or be believed if they did. Many experiments took place in psychiatric hospitals where patients believed they were receiving legitimate treatment for their mental health conditions. Researchers would drug subjects without their knowledge, then use hypnosis and psychological manipulation to attempt to extract information or implant false memories. Some experiments involved creating multiple personalities in subjects through severe psychological trauma combined with drug administration. The program also explored whether people could be programmed to commit acts of violence or sabotage while in altered states of consciousness, then have their memories of these acts erased. Many of the techniques used in Artichoke were later applied in actual CIA interrogations of suspected foreign agents and prisoners of war. The research violated informed consent principles and caused lasting psychological damage to many subjects. Some people developed severe mental illness, memory problems, and personality disorders as a result of their participation in these experiments. Like other CIA mind control programs, Artichoke operated with complete disregard for medical ethics, treating human subjects as expendable resources in the pursuit of intelligence advantages. Most records from the program were destroyed in the 1970s to prevent exposure of the illegal activities, making it difficult to determine the full extent of the damage caused to subjects. 13. The Holmesburg Prison Experiments. From 1951 to 1974, dermatologist Dr. Albert Kligman conducted hundreds of unethical medical experiments on prisoners at Holmesburg Prison in Philadelphia, Pennsylvania, treating inmates as human laboratory animals for testing cosmetics, pharmaceuticals, and chemical weapons. Kligman gained access to the prison population after being called to investigate a fungal outbreak, reportedly exclaiming that he saw acres of skin when he first viewed the potential subjects. The experiments were funded by various organizations including the US Army, pharmaceutical companies like Johnson & Johnson, and cosmetics manufacturers who wanted to test their products on human subjects. Prisoners were paid small amounts of money to participate in studies that exposed them to dangerous chemicals, experimental drugs, and various toxins without adequate safety precautions or informed consent. Many experiments involved applying concentrated chemical agents directly to prisoners' skin to test irritation levels, absorption rates, and toxicity. Subjects were exposed to dioxin, the same chemical found in Agent Orange, with doses up to 468 times stronger than those that caused chloracin in chemical workers. Other experiments tested the effects of radioactive materials, experimental pharmaceuticals, and various toxins by applying them to prisoners' backs, arms, and faces. The conditions in which experiments were conducted were deplorable, with prisoners kept in hot, poorly ventilated cells, while dangerous chemicals were applied to their skin and left for days or weeks. Many subjects developed severe chemical burns, permanent scarring, and systemic health problems from absorption of toxic substances through their skin. Kligman showed complete disregard for the welfare of his subjects, viewing prisoners as ideal research subjects because they were available for extended periods and unlikely to pursue legal action. The experiments violated medical ethics, informed consent principles, and basic human rights, exploiting the vulnerability of incarcerated individuals who had limited alternatives for earning money. Many former subjects later developed cancers and other serious health problems that they attributed to their participation in the experiments, though proving causation was difficult due to poor record-keeping and the passage of time. 14. The Willowbrook Hepatitis Study. Between 1956 and 1970, researchers at the Willowbrook State School in New York conducted a controversial study that deliberately infected mentally disabled children with hepatitis to test potential vaccines and treatments. Dr. Saul Krugman led this research at an institution that housed thousands of children and adults with intellectual disabilities in overcrowded, unsanitary conditions where hepatitis outbreaks were common. The researchers argued that since most children at Willowbrook would naturally contract hepatitis due to the poor conditions, it was ethical to deliberately infect some children under controlled circumstances to advance medical knowledge. However, this reasoning violated fundamental principles of medical ethics by using vulnerable children as test subjects without their ability to provide meaningful consent. The study involved feeding live hepatitis virus to newly admitted children, then monitoring the progression of their illness while testing various treatments and preventive measures. Parents were told that participation in the study was a condition for their child's admission to Willowbrook, creating coercive circumstances that made true, informed consent impossible. Many parents were desperate to find institutional care for their disabled children and felt they had no choice but to agree to the research. The children who participated were deliberately made ill with a serious liver infection that caused fever, nausea, jaundice, and potentially life-threatening complications. While the research did contribute to the development of hepatitis vaccines, the methods used were ethically indefensible because they involved intentionally harming vulnerable children who could not advocate for themselves. The study continued for 14 years despite growing criticism from medical ethicists who argued that the same research goals could have been achieved through observational studies of children who contracted hepatitis naturally. The Willowbrook experiments became a landmark case in medical ethics, demonstrating how researchers could exploit vulnerable populations while claiming their work served the greater good. The study violated principles of informed consent, risk-benefit analysis, and protection of vulnerable subjects that are now considered fundamental to ethical human research. 15 Unit 731 Biological Warfare Experiments. Between 1937 and 1945, the Japanese military operated Unit 731, a covert biological and chemical warfare research program that conducted some of the most horrific human experiments in recorded history. Led by microbiologist Shiro Ishii, this program was based in occupied Manchuria and used thousands of Chinese, Korean, Mongolian, and Russian prisoners as test subjects in research designed to develop biological weapons. The unit conducted experiments that included deliberately infecting prisoners with plague, anthrax, cholera, typhoid, and other deadly diseases to study their effects and develop methods for weaponizing these pathogens. Victims, referred to as logs by researchers to dehumanize them, were subjected to vivisection while still alive and conscious, with doctors removing organs, limbs, and body parts to observe the progression of various diseases. Some experiments involved freezing prisoners' limbs to study frostbite, then thawing them to observe tissue death and gangrene development. Others were subjected to pressure chambers, centrifuges, and exposure to extreme temperatures to test human survival limits. The unit also conducted experiments involving surgical procedures without anesthesia, including removing organs, performing unnecessary amputations, and testing various surgical techniques on living subjects. Women were infected with syphilis and other sexually transmitted diseases, then forced to become pregnant to study how infections affected fetal development. Children were also used in experiments, with some being deliberately infected with diseases to study pediatric disease progression. The research had no therapeutic purpose and was conducted purely to develop more effective methods of biological warfare that could be used against enemy populations. An estimated 10,000 to 12,000 people died as a result of Unit 731 experiments, though the exact number remains unknown because many records were destroyed. After the war, the United States granted immunity to Unit 731 researchers in exchange for their data, allowing war criminals to escape prosecution while benefiting from information gained through torture and murder. This decision represents one of the most controversial aspects of post-war justice, prioritizing scientific and military intelligence over accountability for crimes against humanity. Human experiments, 16 to 30 detailed explanations, 16 Guatemalan syphilis experiments. Between 1946 and 1948, United States government researchers deliberately infected hundreds of Guatemalan citizens with syphilis and other sexually transmitted diseases without their knowledge or consent. This unethical study was conducted by Dr. John Cutler under the supervision of the U.S. Public Health Service, the same organization responsible for the Tuskegee experiments. The research was designed to test the effectiveness of penicillin as a preventive treatment for syphilis, but the methods used violated every principle of medical ethics and international law. Researchers targeted vulnerable populations including prisoners, mental patients, soldiers, and sex workers who had limited ability to refuse participation or report abuse. The infections were transmitted through various methods, including direct inoculation, infected prostitutes, and contaminated medical procedures. Prisoners were promised early release or other benefits if they participated, while mental patients were given no choice at all. Many subjects were infected through visits with prostitutes who had been deliberately infected by researchers, while others received direct injections of syphilis bacteria during routine medical examinations. The study infected approximately 1,300 people, including soldiers, prisoners, psychiatric patients, and orphaned children. Many subjects developed painful symptoms including genital sores, rashes, and neurological problems, while others died from complications related to their infections. Even those who received penicillin treatment were not always cured because researchers sometimes provided inadequate doses to study the progression of partially treated infections. The experiments were conducted in secret with the cooperation of Guatemalan government officials who were paid by American researchers. When the study ended, many subjects were never informed they had been infected or provided with proper treatment for their conditions. The full extent of these experiments only became public in 2010 when researcher Susan Reverby discovered archived documents while studying the Tuskegee experiments. This revelation led to formal apologies from the United States government and compensation payments to survivors and their families, though the damage caused by decades of untreated infections could never be fully remedied. 17. The Monster Study, 1939. In 1939, graduate student Wendell Johnson and his assistant Mary Tudor conducted a speech pathology experiment at the University of Iowa that deliberately attempted to induce stuttering in normal-speaking children. The study, later dubbed the Monster Study due to its cruel methodology, involved 22 orphan children from the Iowa Soldiers' Orphans Home, who were divided into two groups based on their existing speech patterns. Half of the children were stutterers who received positive speech therapy, while the other half were normal speakers who were subjected to negative feedback designed to make them develop speech problems. The children in the experimental group were constantly criticized for their speech, told they were beginning to stutter, and made to feel self-conscious about every word they spoke. Researchers told these children that their speech was terrible, that they should think carefully before speaking, and that they were showing signs of developing serious speech defects. The negative reinforcement continued for several months, with children being repeatedly told they were failing and that their speech was getting worse. Many of the normal-speaking children began to show signs of speech anxiety, became reluctant to speak, and developed some stuttering behaviors as a result of the psychological pressure. The children who were already stutterers and received positive therapy showed some improvement, but this positive outcome did not justify the harm caused to the control group. The study violated informed consent principles because the children were not told the true purpose of the research, nor were their guardians informed that some children would be subjected to deliberate psychological harm. The institutional officials who allowed the research were not adequately informed about the experimental methods or potential risks to the children. Several children in the experimental group suffered lasting effects, including reduced self-esteem, speech anxiety, and reluctance to speak in social situations. The study provided little useful scientific information because the artificial conditions and psychological pressure made it impossible to study natural speech development. This experiment became a landmark case demonstrating how researchers could cause lasting harm to vulnerable subjects while contributing little to scientific knowledge. 18. Radioactive food studies. During the 1940s and 1950s, researchers at various institutions across the United States conducted studies involving feeding radioactive materials to unsuspecting subjects, including children, prisoners, and mentally disabled individuals. These experiments were conducted as part of broader research into the effects of radiation exposure during the early nuclear age, when scientists were still learning about the health consequences of radioactive materials. At the Fernald School in Massachusetts, researchers fed radioactive iron and calcium to mentally disabled children, telling their parents the children were joining a science club that would provide them with special meals and extra attention. The consent forms made no mention of radioactive materials, instead describing the research as studying the nutritional value of different foods. Children were given breakfast cereals, milk, and other foods laced with radioactive isotopes, then monitored to see how their bodies absorbed and processed these materials. Similar experiments were conducted at other institutions, including studies where prisoners were fed radioactive materials to test absorption rates and health effects. Researchers at MIT fed radioactive iron to elderly men at a nursing home, while other studies involved giving radioactive materials to pregnant women to study how radiation crossed the placental barrier. The doses administered were often much higher than what people might encounter from medical procedures or environmental exposure, creating significant health risks for the subjects. Many participants were never informed they had consumed radioactive materials, and follow-up studies to monitor their long-term health were often inadequate or non-existent. Some subjects later developed cancers and other health problems that may have been related to their radiation exposure, though proving direct causation was difficult due to the passage of time and poor record keeping. These experiments violated informed consent principles and exposed vulnerable populations to unnecessary health risks in pursuit of scientific knowledge. The studies were conducted during an era when radiation risks were not fully understood, but researchers knew enough about the potential dangers to warrant proper informed consent and safety precautions that were not provided. The Little Albert Experiment. In 1920, behaviorist John Watson and graduate student Rosalie Rayner conducted a controversial psychological experiment at Johns Hopkins University that deliberately induced fear in an infant to test theories about learned emotional responses. The subject, known as Little Albert, was a 9-month-old baby selected for the study because he showed no natural fear of animals or loud noises. The researchers wanted to demonstrate that fears could be conditioned through association, using principles of classical conditioning similar to those discovered by Ivan Pavlov. The experiment began by exposing Albert to various stimuli, including a white rat, rabbit, dog, monkey, and cotton wool, to confirm he had no innate fears of these objects. Albert showed curiosity and reached out to touch these items without any signs of distress or anxiety. The conditioning phase involved presenting Albert with a white rat, while simultaneously striking a steel bar with a hammer directly behind his head, creating a loud, startling noise that naturally frightened the infant. This pairing was repeated multiple times over several sessions, with Albert becoming increasingly distressed each time he saw the rat. Eventually, Albert began crying and attempting to crawl away whenever he saw the white rat, even without the accompanying loud noise. The researchers then tested whether this conditioned fear would generalize to other similar objects, finding that Albert also became afraid of other white, furry objects, including a rabbit dog cotton wool and even a Santa Claus mask with a white beard. The experiment successfully demonstrated that emotional responses could be learned through conditioning, but it violated ethical principles by deliberately causing psychological harm to an infant who could not consent to participation. Albert's mother removed him from the study before researchers could attempt to reverse the conditioning, leaving the child with lasting fears that may have affected his psychological development. The experiment provided no therapeutic benefit to Albert and served only to advance theoretical knowledge about learning processes. Modern ethical standards would never permit such research because it involves deliberately harming a vulnerable subject for purely academic purposes without any possibility of benefit to the participant. 20. The Pit of Despair. Between 1957 and 1963, psychologist Harry Harlow conducted a series of deeply disturbing experiments at the University of Wisconsin involving the deliberate psychological torture of rhesus monkeys to study the effects of maternal deprivation and social isolation. The most notorious of these experiments involved placing infant monkeys in devices Harlow called pits of despair, which were essentially solitary confinement chambers designed to induce severe depression and psychological breakdown. These chambers were vertical metal boxes with sloped sides that made it impossible for the monkeys to climb out, forcing them to remain at the bottom in complete isolation for weeks or months. Harlow designed these devices specifically to create what he called a well of despair from which no animal could escape, with the explicit goal of inducing severe psychological disturbance in his subjects. Monkeys placed in these chambers quickly developed symptoms resembling severe depression in humans, including withdrawal, self-harm, rocking behaviors, and complete loss of interest in food or social interaction. Many animals engaged in repetitive self-injurious behaviors, such as biting themselves, pulling out their own hair, and hitting their heads against the chamber walls. Even after being removed from isolation, most monkeys never recovered normal social behaviors and remained severely psychologically damaged for the rest of their lives. Harlow also conducted experiments involving separating infant monkeys from their mothers and providing them with artificial surrogate mothers made of wire or cloth to study attachment formation. He created additional torture devices, including a rape rack, for forcing mating behaviors and vertical chambers that isolated monkeys for up to 2 years. The researcher showed remarkable callousness toward his subjects, often describing their suffering in casual terms and expressing satisfaction when his methods successfully induced psychological breakdown. While Harlow argued his research provided valuable insights into human psychology and the importance of maternal bonding, The extreme cruelty involved and the lasting trauma inflicted on hundreds of animals raised serious ethical questions about the limits of scientific inquiry. These experiments contributed to growing awareness of animal rights and led to stricter regulations governing psychological research involving animal subjects. 21. The third wave. Experiment. In April 1967, high school history teacher Ron Jones conducted a controversial classroom experiment at Cubberley High School in Palo Alto, California, that demonstrated how easily ordinary students could be transformed into a fascist-like movement. The experiment began when Jones was teaching about Nazi Germany, and students questioned how the German people could have allowed the Holocaust to happen. To illustrate how totalitarian movements develop, Jones created a fictional social movement called the Third Wave, complete with symbols, salutes, and strict behavioral rules. On the first day, Jones introduced concepts of discipline and community, requiring students to sit up straight, speak only when called upon, and begin each sentence with Mr. Jones. Students responded enthusiastically to the structure and sense of belonging the movement provided. The second day focused on community, with Jones teaching students a special salute and greeting that members would use to identify each other. Students began seeking out other third-wave members throughout the school and recruiting new participants. By the third day, the movement had grown to over 200 students who carried membership cards, followed strict behavioral codes, and reported on classmates who violated the rules. Jones was shocked by how quickly students abandoned their individual identities and critical thinking in favor of group conformity and blind obedience. Students who had been friends began turning on each other, with some reporting violations to Jones and demanding punishment for non-conforming behavior. The atmosphere in the school became increasingly authoritarian, with third-wave members intimidating students who refused to join and creating an environment of fear and suspicion. On the fourth day, Jones told students they were part of a national movement that would be revealed in a special assembly, but instead used this gathering to reveal the true nature of the experiment. He showed students films of Nazi Germany and explained how their behavior over the past week paralleled the rise of fascism, demonstrating how easily people could abandon democratic values in favor of authoritarian structure. Many students were deeply disturbed to realize how quickly they had embraced authoritarian behaviors and turned against their classmates, while others remained defensive about their participation even after learning the truth about the experiment. 22. Aversion therapy for homosexuality. During the 1950s through 1970s, mental health professionals conducted numerous aversion therapy experiments attempting to change homosexual orientation through painful conditioning techniques, treating gay men and lesbians as mentally ill patients who needed to be cured. These treatments were based on behaviorist theories, suggesting that sexual orientation could be modified through conditioning, despite lack of evidence that such approaches were effective or that homosexuality required treatment. Some experiments involved more extreme measures, including administering apomorphine, a drug that caused severe vomiting while subjects viewed images of attractive same-sex individuals. Other treatments used electroshock therapy, painful injections, or psychological techniques designed to create shame and disgust around homosexual thoughts and feelings. Many subjects were voluntary participants who sought treatment because they had internalized societal prejudices against homosexuality and believed their orientation was a mental illness that needed correction. However, others were coerced into treatment by family members, employers, or legal authorities who threatened consequences if they refused to undergo conversion therapy. The treatments were typically conducted over weeks or months, subjecting participants to repeated sessions of pain and psychological manipulation designed to alter their fundamental sexual and emotional responses. Most subjects experienced no lasting change in their sexual orientation despite enduring significant physical and psychological trauma during treatment. Many participants developed depression, anxiety, post-traumatic stress disorder, and other mental health problems as a result of these interventions. The treatments violated informed consent principles because subjects were not adequately informed about the lack of evidence for effectiveness or the potential for lasting psychological harm. These experiments reflected and reinforced societal prejudice against sexual minorities while providing no therapeutic benefit to participants, instead causing additional suffering to people who were already marginalized and discriminated against in society. 23 learned helplessness experiments. In the 1960s and 1970s, psychologist Martin Seligman conducted experiments on dogs at the University of Pennsylvania that led to his theory of learned helplessness. But these studies involved subjecting animals to inescapable electric shocks that caused severe psychological trauma. The initial experiments involved restraining dogs in harnesses and administering painful electric shocks that the animals could not avoid or escape, continuing this treatment until the dog stopped trying to flee and became passive and withdrawn. After this conditioning phase, dogs were placed in situations where they could easily escape the shocks by jumping over a low barrier, but many animals remained motionless and accepted the pain rather than attempting to flee. Seligman concluded that the dogs had learned they were helpless to control their environment, leading them to give up even when escape became possible. While this research contributed to understanding of depression and trauma responses in humans, the methods used caused unnecessary suffering to laboratory animals who were subjected to prolonged stress and pain. The experiments involved hundreds of dogs who were repeatedly shocked until they developed symptoms resembling severe depression, including withdrawal, loss of appetite, and lack of response to normal stimuli. Many animals showed lasting behavioral changes that persisted long after the experiments ended, suggesting permanent psychological damage from their experiences. Seligman later extended his research to humans, conducting studies where college students were subjected to uncontrollable loud noises or unsolvable problems to induce feelings of helplessness. While these human studies were less physically harmful than the animal experiments, they still involved deliberately causing psychological distress to research subjects without clear therapeutic benefit. The learned helplessness theory became influential in psychology and led to better understanding of depression, trauma, and resilience. But critics argued that the same insights could have been gained through less harmful research methods. The experiments raised important questions about the ethical limits of psychological research and whether scientific knowledge justifies causing deliberate harm to research subjects. Modern animal research standards require more stringent justification for studies involving pain or distress, and many of Seligman's original experiments would not be permitted under current ethical guidelines. 24 lobotomy experiments. From the 1930s through 1950s, thousands of patients underwent experimental lobotomy procedures that involved deliberately damaging brain tissue to treat various mental health conditions, often without proper informed consent or adequate understanding of the risks involved. Portuguese neurologist Antonio Egas Moniz developed the first lobotomy procedures in 1935, and American neurologist Walter Freeman popularized these techniques in the United States, performing thousands of operations on patients with conditions ranging from schizophrenia to depression to simple behavioral problems. The procedure involved severing connections in the brain's prefrontal cortex, either through drilling holes in the skull or through the eye socket using an instrument resembling an ice pick. Freeman developed a particularly crude technique called the transorbital lobotomy, where he would insert a sharp instrument through the patient's eye socket and move it back and forth to destroy brain tissue. Many procedures were performed without proper anesthesia, with patients remaining conscious while their brains were being damaged. The operations were often conducted in non-sterile environments, including Freeman's office, with minimal surgical precautions. Patients and their families were rarely informed about the experimental nature of the procedures or the potential for severe complications, including personality changes, cognitive impairment, and death. Many lobotomies were performed on vulnerable populations, including institutionalized mental patients, children, and individuals who had been committed against their will. The procedures often resulted in dramatic personality changes, with patients becoming docile and emotionally blunted, losing their ability to experience normal human emotions and relationships. While some patients showed reduced symptoms of agitation or aggression, most experienced significant cognitive impairment, and many became completely dependent on others for basic care. The mortality rate for lobotomy procedures was significant, with some patients dying during or immediately after surgery from hemorrhaging or infection. Despite limited evidence of effectiveness and high rates of complications, the procedures continued to be performed on thousands of patients throughout the 1940s and 1950s. Many patients who survived lobotomies lived the rest of their lives with severe cognitive and emotional impairments that prevented them from functioning independently or maintaining meaningful relationships. 25. Electroshock therapy without consent. Throughout the mid-20th century, electroconvulsive therapy was frequently administered to psychiatric patients without their informed consent, often as punishment for uncooperative behavior rather than as legitimate medical treatment. While ECT can be an effective treatment for severe depression when properly administered with anesthesia and muscle relaxants, many historical applications violated medical ethics and patient rights. Patients in psychiatric institutions were often subjected to electroshock treatments without being informed about the procedure, its risks, or alternative treatments available. Many treatments were administered without proper anesthesia or muscle relaxants, causing patients to experience the full force of electrically induced seizures while conscious, resulting in broken bones, severe pain, and psychological trauma. The procedures were frequently used as a form of behavioral control rather than therapy, with staff administering shocks to patients who were considered difficult, uncooperative, or disruptive. Some institutions used the threat of electroshock therapy to maintain order, creating an atmosphere of fear among patients who might be subjected to painful procedures for minor infractions of institutional rules. Children and adolescents were also subjected to these treatments, sometimes for conditions that would not warrant such intervention under modern standards. The number of treatments administered often exceeded medical recommendations, with some patients receiving hundreds of sessions over their institutional stay. Many patients experienced significant memory loss, cognitive impairment, and personality changes as a result of repeated electroshock treatments, effects that were sometimes permanent. The lack of informed consent meant that patients could not make educated decisions about their treatment or refuse procedures they found objectionable. Family members were often not informed about the use of electroshock therapy or were given misleading information about its safety and effectiveness. The institutional setting made it difficult for patients to advocate for themselves or seek alternative treatments, creating a coercive environment where consent was meaningless. Some patients developed post-traumatic stress disorder from repeated forced electroshock treatments, associating medical settings with fear and helplessness. These practices contributed to public mistrust of psychiatric treatment and highlighted the need for stronger patient rights protections in mental health care settings. 26. The Fernald School Radiation Studies. Between 1946 and 1956, researchers from MIT and Harvard University conducted radiation experiments on mentally disabled children at the Walter E. Fernald State School in Massachusetts, feeding them radioactive materials without proper informed consent from their parents or guardians. The studies were funded by the Atomic Energy Commission and Quaker Oats Company as part of broader research into how the human body processes radioactive substances. Researchers targeted approximately 100 boys aged 10 to 17 who lived at the institution, recruiting them for what was described as a special science club that would provide additional privileges and better food. Parents received letters describing the research as studies of dietary nutrition that would help scientists understand how different foods are digested with no mention of radioactive materials or potential health risks. The consent forms were deliberately misleading, presenting the research as beneficial nutritional studies rather than radiation experiments that could pose health risks to the children. Boys who participated were fed breakfast cereals, milk, and other foods containing radioactive iron and calcium isotopes, then monitored through blood tests and other examinations to track how their bodies absorbed these materials. The radioactive doses administered were significantly higher than background levels that people might encounter naturally, creating potential health risks that were not disclosed to the children or their families. Many boys continued to consume radioactive materials regularly over several years, creating cumulative exposure that increased their risk of developing cancer and other health problems later in life. The institutional setting made meaningful consent impossible because the children were wards of the state who could not make independent decisions about their participation in research. Staff at the school promoted the studies as beneficial opportunities for the boys, creating social pressure to participate and making it difficult for children to refuse. Follow-up studies to monitor the long-term health effects of radiation exposure were inadequate, leaving uncertainty about whether participants developed health problems related to their involvement in the experiments. The experiments violated informed consent principles, exploited vulnerable children who could not advocate for themselves, and exposed them to unnecessary health risks for research that served commercial and military interests rather than their medical needs. 27 Prison Malaria Studies. During World War II and the following decades, researchers conducted extensive malaria experiments on prisoners in various institutions across the United States, deliberately infecting inmates with the disease to test potential treatments and preventive measures. The largest of these studies took place at Stateville Penitentiary in Illinois, where approximately 400 prisoners were infected with malaria between 1944 and 1946 as part of research sponsored by the University of Chicago and the U.S. military. Prisoners were recruited for these studies with promises of early parole consideration, reduced sentences, or monetary compensation, creating coercive circumstances that made truly voluntary consent difficult or impossible. The research involved infecting prisoners with malaria parasites through mosquito bites or direct blood transfusions, then monitoring the progression of their illness while testing various anti-malarial drugs. Many subjects became severely ill with high fevers, chills, nausea, and other debilitating symptoms that could last for weeks or months. Some prisoners developed complications including cerebral malaria, which could cause permanent brain damage or death if not properly treated. The experimental treatments being tested were often ineffective or caused serious side effects, leaving many prisoners to suffer through prolonged illness without adequate relief. Researchers maintained detailed records of symptoms and treatment responses but showed little concern for the welfare of their subjects, treating them primarily as sources of data rather than human beings deserving medical care. Some prisoners died during these experiments, though determining exact casualty rates is difficult due to incomplete record keeping and the deliberate destruction of documents after the studies ended. The institutional setting made it impossible for prisoners to seek independent medical advice or withdraw from the studies once they became ill, creating a captive population that could be exploited for research purposes. Even prisoners who survived the initial infection often suffered lasting health effects, including chronic fatigue, recurring fever episodes, and increased susceptibility to other diseases. The studies violated informed consent principles because prisoners were not adequately informed about the risks involved and faced coercion through promises of early release or other benefits. These experiments represented a clear exploitation of vulnerable populations who had limited ability to protect themselves from research abuse. 28. The Iowa Stuttering Experiment. In 1939, University of Iowa graduate student Mary Tudor conducted a speech therapy experiment under the supervision of Professor Wendell Johnson that attempted to induce stuttering in normally speaking orphaned children through negative reinforcement and psychological pressure. The study involved 22 children from the Iowa Soldiers' Orphans Home who were divided into 4 groups based on their existing speech patterns and the type of treatment they would receive. Children who already stuttered were split between those receiving positive encouragement and those receiving negative criticism, while normally speaking children were similarly divided between positive reinforcement and deliberate attempts to make them develop speech problems. The experimental group of normal-speaking children were repeatedly told they were beginning to stutter, that their speech was becoming problematic, and that they needed to be careful about how they spoke to avoid developing serious speech defects. These children were criticized for normal speech patterns, made to feel self-conscious about every word they uttered, and subjected to months of psychological pressure designed to make them doubt their speaking abilities. The negative reinforcement continued over several sessions, with researchers consistently telling the children that their speech was deteriorating and that they were showing early signs of stuttering. Many of the normally speaking children began to show signs of speech anxiety, became reluctant to participate in classroom discussions, and developed some stuttering behaviors as a direct result of the psychological manipulation. The children were not informed about the true nature of the research, nor were their caregivers at the orphanage adequately briefed about the potential psychological harm the study might cause. The institutional setting made it difficult for children to refuse participation or seek protection from the harmful treatment they were receiving. Several children in the experimental group suffered lasting effects including reduced self-confidence, ongoing speech anxiety, and reluctance to speak in social situations that persisted long after the study ended. The research provided little scientific value because the artificial conditions and deliberate psychological harm made it impossible to study natural speech development processes. This experiment became a landmark case in research ethics, demonstrating how vulnerable populations could be exploited and harmed in pursuit of academic knowledge that offered no benefit to the subjects themselves. 29. Facebook Emotional Manipulation Study 2014. In 2014, Facebook conducted a secret psychological experiment on 689,003 users without their knowledge or consent, manipulating their news feeds to study how emotional content affected their own posting behavior. The study, conducted in collaboration with researchers from Cornell University and the University of California, San Francisco, involved algorithmically altering what content users saw in their news feeds for 1 week in January 2012. Users were randomly assigned to groups where their feeds were manipulated to show either more positive or more negative emotional content by filtering posts containing emotional language. The positive emotion group saw fewer posts containing negative words, while the negative emotion group saw fewer posts with positive emotional content. Researchers then analyzed whether users who saw more positive content posted more positive content themselves, and whether exposure to negative content led to more negative posting behaviors. The study found that emotional states could be transferred to others through social media exposure, with users whose feeds contained more positive content subsequently posting more positive content, and vice versa. While the effect sizes were small, the researchers argued that the findings demonstrated emotional contagion through social networks and had implications for understanding how social media affects mental health and behavior. However, the experiment raised serious ethical concerns because users were never informed they were participating in psychological research that could potentially affect their emotional well-being. The manipulation of news feeds meant that some users were deliberately exposed to more negative emotional content, potentially worsening their mood or mental health without their knowledge. The study violated informed consent principles because Facebook users had not agreed to participate in psychological experiments when they signed up for the social media platform. Many users expressed outrage when the study was published, feeling that their trust had been violated and that they had been treated as unwitting laboratory subjects. Critics argued that the research could have caused harm to vulnerable users particularly those already struggling with depression or other mental health issues who might have been negatively affected by exposure to more negative content. The controversy highlighted questions about the ethical responsibilities of technology companies when they conduct research on their users and the need for clearer guidelines about consent for digital experiments. 30. Pharmaceutical testing in developing nations. Throughout recent decades, pharmaceutical companies have conducted numerous clinical trials in developing countries that exploited economic inequality and inadequate regulatory oversight to test experimental drugs on vulnerable populations without proper ethical safeguards. These studies often targeted people who lacked access to basic healthcare and were desperate for any medical treatment, creating coercive circumstances that made meaningful informed consent difficult or impossible. Many trials offered free medical care or small payments that represented significant income for participants living in poverty, creating financial pressure to enroll in potentially dangerous research. Companies frequently chose developing countries for drug trials because regulatory requirements were less stringent, labor costs were lower, and participants were less likely to pursue legal action if something went wrong. Some studies provided lower standards of care than would be required in wealthy countries, with participants receiving inadequate medical monitoring, substandard treatments for side effects, or experimental drugs without access to established effective treatments. Informed consent processes often failed to account for language barriers, cultural differences, or low literacy rates among potential participants, resulting in people agreeing to procedures they did not fully understand. Many trials tested drugs for diseases that primarily affected wealthy countries, meaning participants would not benefit from the research results even if successful treatments were developed. When studies were completed, participants were often left without continued access to experimental treatments that had helped them, even in cases where the drugs proved effective and became commercially available in wealthy nations. Some research involved testing lower doses of established medications to determine minimum effective levels that would be cheaper to manufacture, essentially using poor people to find ways to reduce costs rather than improve health outcomes. Clinical trials for HIV treatments in Africa during the 1990s became particularly controversial when researchers used placebo controls instead of providing established treatments, allowing preventable infections to occur among participants. These practices reflected broader patterns of medical colonialism, where wealthy countries and corporations extracted benefit from developing nations while providing minimal benefit to local populations. The exploitation of vulnerable populations for pharmaceutical research highlighted the need for international ethical standards and oversight mechanisms to protect research participants regardless of where studies are conducted.